Welcome to the Medical Symposium. Some of you were here yesterday during the PFG, Patient and Family Gathering, and some are new faces since yesterday. So I welcome you all again. We had a great day yesterday hearing about patient perspectives, and it was as always, very enlightening to learn about the things patients care about and the challenges we still struggle with. And that dovetails very nicely into is the research we are doing answering some of those questions and concerns. So I'm your host, Gaurav. I'm a hematologist-oncologist adult in UAB. I've been here nearly 7 years, and I am a proud host this year, co-host with the ECDGA. So welcome to Birmingham. I'm sure many of you have not been here before, but there's a lot to offer in this city. You have the Botanical Gardens, the Civil Rights Institute, and then the Art Museum. Of course, the barbecue food, if you have not had it. I have some recommendations I can give you offline. But please, if you have not had a chance to explore, go ahead and explore the city a little bit while you're here. Some of us already went out and have been exploring and socializing. So this is not just about research, this is community. So I added these slides together from last night. As you can see, some of us even made it to the Vulcan Museum, even though we were not allowed entry. Some of our scientists who got the award last night, they were very committed to go to the Vulcan and get a picture by the Vulcan Museum. So we made that happen. The details are blurry. And then, of course, nothing would be possible without sponsors. So we are very happy and proud that we have good sponsorship from Recordati, Biomed Valley Discoveries, Foundation Medicine, and ARUP Labs. So we are very thankful for their support. Is the history of ECD that most of you may know, but I'll go over it anyway to just remind ourselves how this journey has been. First, it was discovered or thought of as a unique entity in 1930 by Dr. Erdheim-Chester. And then, long time later, interferon started being used as a treatment. After that, ECDGA was founded in 2008 by Kathy Brewer, who unfortunately is not here and in person. And then NIH started the natural history study, followed by the discovery of the BRAF V600E mutation in 2012. And that really got a lot of discoveries moving toward our understanding of ECD as a cancer. It's getting the scientists together to think about it like that and discover treatments, targeted treatments. The registry was created in 2014, followed by care center establishment that many of you are leading or part of. In 2016, the World Health Organization recognized ECD as a clonal hematopoietic neoplasm. And then vemurafenib was the first drug that was approved for ECD based on a large basket trial of which ECD was an arm, and that led by Dr. Diamond. It was an example of how you can get a drug approved in a ultra-rare disease. Another victory was the National Comprehensive Cancer Center Network guidelines that were created because a lot of insurers look to these guidelines to approve PET scans, NGS testing, and so forth. And this was followed by the approval of cobimetinib through a phase 2 trial, also led by Dr. Diamond, in adult histiocytic neoplasms. And now we are looking to the questions, now what do we do next? And how can we make the lives better? We may have improved the survival from the disease, but how can we make their lives even better going forward? Or how can we cure the disease? So I'm very hopeful for the future. So there are many ECD patients registered in the ECDGA, 1,138 as of last tally, and there are about 42 care centers now. So that list is growing as well, showing that there is a need and hunger for these rare disease physicians, rare disease centers, and so forth. There are many ECDGA programs offered to patients as well as clinicians, starting from patient navigator program to online peer chats, 2 webinars, which some of us have participated in. There's the annual conference. There's a care center referral network, so people can easily look up what is the care center closest to them and get access. ECDGA also supports research funding, and this year we heard Dr. Roca got the award. So it's not just about talking about the disease, but actually moving the needle in a positive direction through real funding. And research recruitment efforts, they're helping with some study recruitment, including the registry as well as the survivorship study. Education and awareness efforts, of course, they have to go hand in hand so we can diagnose the disease early or disseminate the findings from our research. Exciting thing is we have door prize tickets. The tickets are in your conference bag. These will be drawn at the end of the day, so you don't sneak out before the end of the day. So these are very exciting prizes. I cannot reveal the prize to you yet. One prize, very exciting, one prize, because it needed to be super, super exciting prize, so we could only afford one, and that's going to be drawn at the end of the day. Key reminders, the bathrooms are past the elevators on the right. If you go, and group picture is 11:45 a.m. right before lunch. There is a medical reception. It's at the terrace up on the 3rd floor. It's a very nice area, and thankfully it's not going to rain, so we can be outside. It'll be great. So please remember that. Care center meeting for care center physicians who are planning to stay back is tomorrow, so we can reflect from our meeting and also discuss how we can improve care and awareness for these patients. That's in the Cancer Center in Wallace Tumor Institute 101. It's not far from here, 2 blocks. So today's focus, of course, listen, build collaborations, learn, being part of a community. And one of the things I attended a conference recently, and I saw this slide, and I think it was very important to me, is why are we here? When we think about asking a question, I think the number one thing is there are some best practices. So there are some wrong questions. So there are some best practices. The most important thing is to pay attention, to listen. Asking open-ended questions is important. I also think that curiosity, like what can I learn versus what can I confirm, I believe in. Curiosity goes a long way compared to criticism. But if you want to give some feedback to someone, we have a lot of young trainees presenting today. We want to motivate them to continue research in histiocytosis. So please give them feedback privately after the conference, but try to be open-minded and ask questions rather than just making comments. So I really wanted to highlight that. So with that, I will open the meeting, unless you have any questions about the format or anything else.